I'm 𝗲𝗄𝗂. I've been a licensed insurance agent now for 26 years. I got my license in 1994 in a place called Florida. And then we moved to South Carolina. We live in Charleston, South Carolina. I have a team of agents that work right outside that door. And we help people with their Medicare choices from coast to coast, from sea to shining sea. Today, I'm going to share with you what's been going on with Medicare Advantage. As recently as last night, an article dropped that will just absolutely blow your mind. And we're going to get into some scammy commercials that are going on right now. And they're actually called infomercials because they try to make it look, or an advertorial, trying to make it look like they're doing something nice for you until you actually look at it. And we actually looked at it, and you'll see some shocking things here in this clip. Going to keep the thing moving, and you're going to hear from one of my biggest critics out there in the world. I'm going to actually show you what he said, and you will be the judge by the end of this video. And I really want to know your comments at the end. I really try to read as many of those as I can. So comment at the end of this video and let me know if you think that the information I'm giving is totally irrelevant and just flabbergasted information that is not real. Let's listen to these people and see what they had to say about what you need to decide about Medicare. Please pay very close attention to this as far as what do you think their consideration is for the other side of Medicare, which I'll go over the two different roads you can go in Medicare in just a minute, but you can go either original Medicare or Medicare Advantage. Let's see what they have to talk about.
We're thinking about health insurance. We're thinking about money, and the type of plan that you choose can have a big impact on your health care costs.
Absolutely. We're talking today about how to sign up for a Medicare Advantage plan during the annual enrollment period. And joining us now is Care Partners of Connecticut, the president, Marla Pantano, and head of sales, Jessie Mejia. Thank you both for being here.
Thank you for having us.
Thank you for the easy names. We so appreciate that. How are you?
Doing great.
It's good to see you. We're back in the thick of it.
We are.
I cannot believe it. It's been a little bit of time since we've seen you, but that December 7th deadline is coming up. It's coming up soon.
That's right. We just started the open enrollment on October 15th, and it runs through December 7th. And this is really your chance to take advantage of changing your plans.
And Jessie, why would you really want to make sure that you're doing that? Because, you know, some people might just be like, I'm just going to do the same thing as last year. This can really save you a lot of money,
Absolutely.
Right?
So doing what you did last year is not prudent because things change every year.
Right, exactly.
So plans change, things change, plans get better. And in our case, Care Partners of Connecticut has incredible plans that I believe everyone should take a look at and go to our website to take a better look to make sure that our plans service their needs.
Saving money is an important factor for many people these days. Is it possible to select a plan that can actually help you save money?
Most definitely. So many people, you know, when they join Medicare after they turn 65, you know, they know that the government provides Medicare, right? And don't give as much thought to what other coverage do I need. You can choose a Medicare supplement plan, but those are very expensive. You pay high premiums, and they don't cover things like drugs and other benefits like dental, etc. You go.
They're very, very expensive, and they don't cover, what don't they cover? Oh, dental. Let's talk about dental for the rest of the video, and only dental, and never talk about what Medicare Advantage doesn't cover, but Medicare supplements do cover, because they can't sell Medicare supplements at their company. They only paid to come here to talk about Medicare Advantage. So let's talk about the best part of Medicare Advantage.
Go into a Medicare Advantage plan, then you have the options to get all of those things covered at $0 premiums. So really you can save a lot of money and get a lot more things covered. So that's really important to look at that.
Yeah, and how does it really work? Like, how does the Medicare Advantage plan really provide the savings?
So
how do you provide the savings? This is a question provided by the people who are paying for this ad, by the way. How do they provide the savings if you're paying zero premium? Where does the money come from if they're able to save you money? How does that work? Here's the weird answer.
Well, several ways. So primarily our deductibles to ensure that if what a member has to pay, then is there a zero cost? Are there premiums attached to a plan? So our plans do not have any premiums where other organizations do. And then you can go as far as additional over-the-counter benefits.
Yes.
And that's important because not all plans offer the same. And primarily dental health.
So important and so expensive if you don't have coverage.
That's right. And so we do have, you know, a couple different options, you know, depending on whether you're able to use a network of providers, dental providers.
Let's not talk about your major medical. let's talk about dental, because that is the most important factor when you're choosing a Medicare plan. Not whether you're going to live or die, or have the heart surgery, or get the CT scan approved, or have prior authorization for getting a back surgery that you've needed now for 6 weeks and they won't give it to you. Forget all that. Talk to me about dental, because that's the only dang thing that we need to talk about with Medicare Advantage.
That offers some really strong benefits, or if you want more flexibility. Some people just want more flexibility to go where they want, when they want, and then we have a plan.
That's ironic, huh? They have an HMO. You have to go inside the HMO. Can't go outside the HMO. You have to go inside the HMO to their doctors. But on the dental, people want flexibility, man. They want to be able to go where they want to go on the dental. But what about the doctors and the... Nah.
For that as well, that really offers excellent coverage. So it is really important, and is almost like, you know, free money.
Yeah, and the dental coverage.
That is so illegal. That violates every Medicare marketing rule that's ever been written. You can never say it's free. The word free is like absolutely legally forbidden in the law. You cannot say free. And here we go. I just blows my mind. They're not even prepared.
People just want more flexibility to go where they want, when they want, and then we have a plan for that as well that really offers excellent coverage. So it is really important, and is almost like, you know, free money.
Yeah, and the dental coverage, you mentioned that, but that's a big consideration. I know a lot of people feel like they don't have any dental coverage sometimes, so this can solve that.
It could solve everything.
It is huge, because we have two plans. One, our PPO plan provides members with a $1,200 dental Visa card.
Oh, wow. Where
no network's required, first dollar, so whatever they need, their first $1,200 is covered.
That's amazing.
That's huge. The second one is a $3,000 HMO, where we do have a network, but those are reimbursements, and it includes crowns. And for our demographic, that's a big deal for them as well.
Yeah,
yeah, that's huge. My mother's in dental surgery right now, as we speak.
Oh, we hope
she's doing good. Hope, knock wood.
And that's really great, because a lot of people, if you're thinking about helping your parents out or whatever, we might have those flex spending cards that we have at work.
Yes,
but
exactly.
It's going to work like that, where you get to use these flex spending cards. Even sometimes it's going to cover over-the-counter type stuff.
That's right.
There's so many. I mean, you could really save hundreds, maybe thousands of dollars by
thousands of dollars.
Thousands.
And that's above and beyond what you get normally under Medicare. So just remember, Medicare doesn't cover those benefits.
And you can get something
normally.
with zero premium.
With zero additional premium. All you do is pay your Part B premium that you already pay through
you have to do,
so your Social Security.
Your Medicare.
And then you enroll in this, and you get all of these other benefits for no additional cost.
All right. How can people find more information about choosing this Medicare Advantage plan during
it's just like free money
time period?
The easiest way is go to our website.
Oh my gosh, it's just like free money. Well, the United States Senate just held hearings on this very thing, and you should hear this. This just happened. Listen to what they have to say about these freebies and how important that is in the context of getting things actually paid for, like your medical health.
Trying to enroll in Medicare coverage for the first time, they meet with a broker or see an advertisement about Medicare Advantage plans offering $0 premiums and boundless supplemental benefits. Sounds good, sometimes too good to be true. Are advertisements like this misleading? And if they are, what should federal government, what should we be doing about it?
They are, and this has gone on for years. We, on all of our public presentations and our counseling, we beg the...
This is a director of the State Department of Insurance, by the way, and she's talking about how this is a big problem, that they're only focused on the extras, not the essentials. And she tries to tell people otherwise.
Consumers do not choose your health, your prescription drug coverage based on an advertisement. The advertisements will focus on the zero premium, zero copay at a primary care, maybe no copay for generic medication. But we really want them to look at things like, what is the copay for inpatient hospitalization per day? And when it comes to Medicare Advantage, also know that maximum out-of-pocket, which would be a limit to their financial risk. So the advertisements over the years have gotten more aggressive, and they do focus on those added benefits, specifically cash allowances, debit cards, money to go into the local drugstore and purchase items that aren't covered. And we have counseled numerous individuals, especially over the past open enrollment year. They were very upset with us because we could not use Medicare's Plan Finder tool to order the plans in order of the highest debit card to the lowest. And when we try to circle back to things like their specific providers, mental health needs, and other critically needed services, they really want to focus on those added benefits. And that has been a challenge for us due to the advertisements.
So is there, and I understand the federal government's recent steps to curb deceptive marketing help seniors sign up for Medicare coverage. Is that helping? Can you see some of that?
We are cautiously optimistic. We'll know more as plans go into effect in 2024.
Yeah, those protections, by the way, from CMS on that marketing stuff, they're going to take effect next year. So just don't worry about it. Next year, you'll stop getting scammed if they start enforcing it finally.
Personally, I've seen a bit of a difference in the commercials that are aired on television and the online ads, but there's still, and I get it, consumers with limited incomes, limited resources, to have those added dollars each month for groceries or utilities is a need. But if we can focus on the critical need, which is their health care and their medical needs, it could hopefully redivert them into plans that are best suited.
Imagine that, plans that are better suited for them. So we often get calls from people, our clients this time of year, as much as we do to try to reach out and educate everybody, because we're an education outfit first, and people call us. We don't call anybody about Medicare. They call us based on our education. From time to time, we'll have clients call us when they've seen a particular commercial and they want what's in that commercial, but they don't understand that they have to give up their original Medicare to get the freebies, to get the extras. They give up the essentials to get the extras. My gosh, you've got to hear this article that just came out. I'm going to show it to you. It just came out by NBC News. Really, really recent and relevant information. You have to see that. But first, I want you to hear this call that I just got yesterday.
Hours ago about dental. I start tomorrow, so I wanted to just get this done today to see if I was able to get the dental, if it was going to be added, no premium. I talked to a gentleman yesterday, and he seemed to have his for free. I wanted to know if I can get free dental. If I could just get a call back just to see if I qualify, and we can get that in there today before I start tomorrow. I don't know if I have time to still sign up for this after my start date. So please get back to me. You guys have been great. Everything else is right on schedule. So I just wanted to see if I can get dental, because I have a supplement plan that I'm going to sign up for in December if I don't. So hopefully you have a good day.
So of course we'll reach out and explain that by giving up your original Medicare, giving up your Medicare supplement, and replacing that completely with a different program, that the major medical may be suspect. And you just have to know, and that's what we do. We just educate people, but wait till you hear this article. I'm going to probably make a lot of people mad. One of my big haters out there on the interwebs, I'm not going to call him out by name. I wouldn't do that. I wouldn't show his video clip and where he's wrong, because I think that's way too personal and probably unprofessional. However, what he said, I extracted and blurred everything and took the extract of his, the transcript rather, of his words, and put it in the most famous voice that's out there on the internet today, the voice of Adam. And I just want you to hear this and then put it in the context of the article I'm about to read to you. So stick around. This will blow your mind. This is from NBC News, not from me. Now, you just heard from the senator talking. You saw the commercial and the fact that it mentioned not one thing about your major medical benefits, all focused 100% entirely on the free. And that's working with people. And my goal on this YouTube channel is to educate people. Now, he makes the point, my commentator here, competitor, he makes the point that we sell Medicare Advantage plans too. And yet I'm telling you all the shocking news about Medicare Advantage and blowing it up way out of proportion. Really? Or is it being a student of our industry and bringing you just what's in the news on a daily basis? Because I wake up at between 4 and 5 and read all the articles that have ever been out there, videos, news articles, and everything about Medicare and what's going on, being a student of the industry. Now, this commentator has had his license almost for a year, and I want to congratulate him. This is November. It just turned November 2023 as I'm recording this. On the 25th of this month, he will have had his insurance license for one whole solid year, and I just want to commend you on that. It's great. Wait, there's the article. Can't get there yet. And I think it is important just to put in context how long somebody's been in the industry, how much experience they have, because all the new agents that are out there that I know currently that are pushing just Medicare Advantage plan don't know shite from shinola when it comes to how those plans actually, when the rubber meets the road and you've got thousands of clients on Medicare, how does the plan actually work? How often are you having to fight for those people and fight the insurance companies? And do you even know what's going on behind you? Do you even know what people are actually signing up for and what their experiences are in the world? Well, let me educate you, my friend, my competitor. And here's what he had to say about me, but I'm not using his video and I'm not even using his voice.
Headlines and the shocking videos from people on YouTube bashing these plans and making you feel bad.
To talk with someone about the letter you received, press 2.
I'm just terrified. I don't have the words, to express how scared I am.
Advantage plans are an easy target. Most of the videos we see on here bashing Advantage plans are from people who still put people on Advantage plans. But a video saying what we said in this video...
So you're saying I'm unbiased and you're accusing me of that. That's cool.
Or, frankly, a video saying, you know what? Supplement plans are great. They don't get as many clicks and views because they aren't as infuriating. We know because we have a bunch of these videos on our channel. Please go watch them.
Okay, please go watch my videos. Sure, okay. But yeah, I do sell both plans because we try to be not all things to all people, but our experience has led us to the conclusion that not everybody can afford a Medicare supplement. So who is going to be their advocate when they have to get an Advantage plan? Who's actually going to look out for them? Oh, we'll take on that role. So if you are going to be on an Advantage plan, I dang sure want you to be with somebody who's going to look out for you and actually cares about your experience while you're on it. I mean, just call me crazy. So let me tell you what's in the news today. That in mind, this is not Christopher Westphal bashing Advantage plans. This is the headline. This is from NBC News. Some would maintain a pretty credible organization for reporting the facts. And this author, in fact, is a Pulitzer Prize-winning author for her research. Stunning research. And this article, I've got a sore throat, getting over a cold. It's a while to go through some of the facts in here, but they'll absolutely blow your mind with the relevance to today as we're in the annual election period. Will any of this stuff happen to you? Maybe not. Probably not. Statistically, probably not. Only 30% of the people are affected by adverse things going on like this. But I think it's my obligation, if I'm educating my public, those people who are calling in here, to set the stage and let you know, as every single one of our clients know full well what they're getting involved in when they're choosing a Medicare Advantage plan, because to do anything else is just absolutely wrong. Deny, deny, deny. By rejecting claims, Medicare Advantage plans threaten rural hospitals and patients, say the CEOs. For decades, Rose Stone, I think I got a picture of Rose. Yep. Rose Stone counted on the Alliance healthcare system in rural Holly Springs, Mississippi for all of her medical needs. But after she retired and signed up for a Medicare Advantage plan, she was surprised to learn it didn't cover her visits to nonprofit Alliance, which is the only healthcare provider within 25 miles. Stone had a choice: use her own money to keep seeing her regular doctor, or drive out of town to see physicians she didn't know, but whose costs were covered by the Medicare Advantage plan. It was a mess, Stone told NBC News. I didn't go to the doctor because I was going to have to pay out of pocket money I didn't have. Some 31 million Americans are on Medicare Advantage plans now. Problems are emerging with the plans, however. Last year, a federal audit from 2013 was released 10 years later, showing that 8 of the 10 largest plans had submitted inflated bills to Medicare. As for the quality of care, the Medicare Payment Advisory Commission, a nonpartisan agency of Congress, said in a March report, March of 2023, that it could not conclude Medicare Advantage plans provide better quality care over regular Medicare. Even worse, because the plans routinely deny coverage for necessary care, I said routinely, they are threatening the existence of struggling rural hospitals nationwide. CEOs of facilities in 6 states told NBC News this. While the number of older Americans who rely on Medicare Advantage in rural communities continue to rise, these denials of care force the hospitals to eat the increasing cost of care, causing some to close operations and leave residents without access to treatment. Quote, "They don't want to reimburse for anything. Deny, deny, deny," said Dr. Kenneth Williams, CEO of Alliance Healthcare. This article's link will be in the description of this video when the live stream's over. He's talking about Medicare Advantage plans. Quote, "They are taking over Medicare and they are taking advantage of elderly patients." Oh, Chris, don't bring that news to us because we don't want to hear it, baby. Sorry. Williams is something of a local hero in Holly Springs, Mississippi. When the area hospital was in danger of closing in 1999, he marshaled resources and bought it to keep it open. Alliance serves the county of 38,000 people. Still this spring, he had to shut down a longtime geriatric psychiatry program that had served the community for 8 years. Quote, "Coverage denials for Medicare Advantage plans killed the program," Williams said. Medicare Advantage are sold assiduously by celebrity pitchmen. One is Joe Namath, as a better way for Americans to qualify for Medicare to get insurance coverage. Many plans add services such as dental and hearing care and wellness programs not offered under traditional Medicare, for which beneficiaries pay extras. The U.S. government pays most beneficiaries' premiums to the insurance companies offering these plans. If the government had hoped Medicare Advantage plans would reduce the cost of care, that has not been the outcome. Medicare pays these plans 6% more than it would have spent if they were under regular Medicare. A study from MedPAC report found Medicare payments to the plans will total $27 billion more in 2023 than if patients had enrolled in traditional Medicare, the report projected. So the new enrollment plan time period is right now. Customers were saying that they were sold Medicare Advantage plans without understanding their limitations. A major complaint, said Mike Cheney, the Mississippi Insurance Commissioner, this pretty credible source. The main complaint is, quote, "Consumers are not aware their doctors are likely to change under the Medicare Advantage programs." I brought that to you every day for the last 6 weeks. Medicare Advantage plans have grown in popularity, with enrollment nearly doubling nationwide since 2013. One explanation, the plans are cheaper than paying for Medicare supplements, sometimes referred to as Medigap. That's right, they're cheaper. Another reason, watch it now, another reason for the growth may be the significantly larger commissions the government pays to brokers selling Medicare Advantage plans. Somebody else is actually saying it now. In 2024, the Center for Medicare and Medicaid Services will pay brokers a commission of between $611 and $762 for the first year of a Medicare Advantage plan, depending on the state, and then roughly half that for annual renewals. They pay that for life, by the way, on Medicare Advantage, not on Medicare supplements. Brokers selling these so-called Advantage plans, I love this, aren't the only ones making money on them. United Health Group, the largest Medicare Advantage provider, generated $257 billion with a B, $257 billion in premium revenues in 2022, 13% over the previous year. A significant driver of that growth, its Medicare Advantage plans, the company's financial filing said. Humana, the next largest, said that 80% of its $51 billion in premium revenues came from Medicare Advantage plans. Meanwhile, CEO of rural nonprofit hospital systems in Arkansas, Colorado, Mississippi, Missouri, South Dakota, and Texas have all told NBC News that Medicare Advantage plans, quote, repeatedly refuse to reimburse them for care that they provide. Some 170 rural hospitals are now at risk for closing in those 6 states alone, according to a report from the Center for Healthcare Quality and Payment Reform. While there are multiple reasons for rural hospitals' financial woes, coverage denials for Medicare Advantage play a big part, said Harold Miller, president of the center that conducted this study. Mary Beth Donahue, industry insider lobbying firm, Better Medicare Alliance, an advocacy group that supports the Medicare Advantage plan, said in a statement, now watch this, we acknowledge the challenges facing some healthcare systems. Challenges. As Medicare Advantage continues to grow, it is essential that hospitals provide access to seniors and people with disabilities on this program? Well, no duh. It is essential and it is a challenge. So what are you going to do about it? No comment. By law, Medicare Advantage plans are supposed to base their reimbursements on Medicare rules. Here it comes. But there's room for interpretation, says the Department of Health and Human Services. For example, insurers can use their own clinical criteria to determine whether to authorize or pay for care. They can just make it up as they go. It's their own criteria. Don't worry about it. If you're on original Medicare, it would have been paid for. Don't worry about it. It's our own internal criteria. A report last year by the department's Inspector General found that in 2019, the 15 top Medicare Advantage plans denied authorization for 13% of claims that had met Medicare's rules. The plan also denied payment for 18% of claims that met Medicare coverage and billing rules, the report said. Only 13%. Even when the plans pay, okay, they reimburse providers far less than traditional Medicare. Rural hospital CEOs and doctors told NBC News for this story. The plans are effectively rationing healthcare, these providers say. For example, the hospital official cited specific cases in which plans take a week to approve care, but agree to only pay for a 3-night stay, deny coverage after approving it, clawing back money from hospitals, or contend that a provider is now out of network when it wasn't. They also deny routine tests and refuse to pay for rehabilitation. That's a big one we hear all the time. Skilled nursing, forget about it. Saying patients should go home before their doctors think it is wise. Quote, any study that we order, X-ray, CT scan, MRI, stress test, they're going to deny, said Craig Pendergrass, a doctor of Ozarks Community Hospital, a nonprofit critical access hospital in 𝗏𝗏𝗃, Arkansas. I know right where that is, in the northwest corner of the state. We used to live in Rogers during the summers and stay with our grandparents. I had a single mom growing up. I know right where 𝗏𝗏𝗃 is. So he said, X-ray, CT scan, MRI, stress test, they're going to deny. With straight Medicare, we just schedule it. He estimated that his staff spends 1/4 of each week trying to persuade the plans not to deny the test or treatment. How do you know this stuff and just sit idly by and not say something about it if you have an audience of any measure? I'm just asking for the new insurance agent who almost been in the industry for a year. Keep coming with your YouTube videos. Keep reading your research studies. Here's the real world. Here's how it really affects people. With straight Medicare, we just schedule it. Large hospital systems with big staffs can dedicate time and energy to fighting these claims denials, said the American Hospital Association. They're pretty credible. Small rural hospitals cannot. In response, smaller systems are starting to reject Medicare Advantage plans. This summer, Jason Merkley, chief executive of Brooking Health Systems, a highly rated nonprofit hospital chain in South Dakota, stopped accepting the plans because of coverage denials and prior authorization problems. Only a small percentage of the system's patients had Medicare Advantage, Merkley told NBC News, but the effort required to battle the denials was considerable. In mid-September, Samaritan Health Systems, a 5-hospital system in Oregon, said that it ended its contract with United Healthcare, including its Medicare Advantage plans. Quote, United Healthcare's processing of requests and claims has made it difficult for Samaritan to provide timely access to the appropriate care to United's members, the system said. Taylor, talking about Paul Taylor, CEO of the 25-bed Ozark Community Hospital, Taylor recently conducted a 2-year study of what his hospital received treating traditional Medicare payments versus what it received from the Medicare Advantage plan. What do you think he discovered? Comparing his original Medicare people, probably with a supplement, maybe from our organization, to a Medicare Advantage plan. This is what the hospital came up with after 2 years of studying. He found that the plans paid $4.5 million less than he received under Medicare for the same treatment. That's roughly what his facility generates in revenues each month. Ozarks Community, which serves 30,000 people, narrowly averted bankruptcy filing this year. He is selling assets to stay afloat. In late August, a patient with chronic obstructive pulmonary disease, COPD, and COVID arrived in the San Luis Valley Regional Hospital Center, a 49-bed level 3 trauma center in Alamosa, Colorado. The nonprofit serves a 6-county region in south central Colorado, roughly the size of Delaware. The area is one of the poorest in the state. The doctor handling the patient recommended admitting her to the hospital, but her United Healthcare Medicare Advantage plan balked. They agreed to pay for observation only of the patient, a lower standard of care that generates much smaller reimbursements. The facility went ahead and treated her as an inpatient for 2 weeks, a stay that cost $29,458, all of which the hospital absorbed, it said. Had the Medicare Advantage plan agreed to pay the claim, it would have paid 1/3, the hospital estimated. Quote, "This is the norm. They push back on people to try to keep them out of the hospital or delay their hospital care. The hospital staff has to spend time resubmitting claims," she said, adding, "It costs us 2 or 3 times the amount of labor and investment to collect on one claim," end quote. Her staff provided us documentation of the 4 recent denials of coverage by United Healthcare in 1 week. The coverage denials the CEO described to NBC News are similar to those found in last year's Health and Human Services report. More corroboration, more people, more organizations are saying the same thing. They included erroneous rejections of MRIs and CT scans, paying only for observation rather than inpatient care. Denials of long-term acute care, I've already said that's the biggest problem there is. Rehab, lab tests, and medical equipment. The Inspector General has said that human error and system processing errors cause most of the denials by Medicare Advantage plans. But the hospital executives NBC News spoke with say that they believe the denials are a, wait for it, strategy by insurers to improve their profits by refusing to pay claims. That's exactly what the IG report said a couple years ago. I think it was 2018. The systematic way of reducing what's paid on claims to increase what comes out in profit, because the difference between the two is the net profit. Quote, "This world of medical billing is so automated. If you're denying a claim, you're doing it intentionally," said Martin. United Healthcare declined to comment. The Cuero Regional Health System, a small hospital in Cuero, Texas, serves a population of 22,000. Its officials say, what do they have to say down there in Texas? Medicare Advantage plans often deny care based on the insurer's internal determinations about the type of care required, overruling the physicians handling the cases. If you want your insurance company, quick aside here, if you want your insurance company to do what the doctor said to do, you better have your butt on the original Medicare and have a Medicare supplement plan. Because see, those Medigap plans, Medicare supplements, they don't go question the doctors. If Medicare approves it as a claim, which they do when a doctor writes the order, the supplements automatically pay the claims. Automatically through a thing called crossover right up there at Medicare. There's no medical director sitting there going, I don't know about this claim. This doesn't meet our internal criteria crap. It doesn't exist. On original Medicare, if your doctor says you need it, you get it. And the supplement just goes right on along for the ride. Yes, supplements are not free. Sometimes you get what you pay for. And you should know that there are 2 different systems. You can have one system or you can have the other system. And guess what? Yes, we represent both because not everybody can go on one particular plan. When the hospital questions a determination called a peer-to-peer review, officials often have to argue with the physician who doesn't specialize in the care the patient requires. Oh, wait for this. You're going to love this one. Said 𝗏𝗏𝗏, its chief executive officer. A Medicare Advantage plan recently denied a referral to a long-term care acute care facility for a patient with sepsis, 𝗏𝗏𝗏 said. When the family practice doctor overseeing the case asked for one of these peer-to-peer reviews, what do you think happened? So they asked the insurance company, hey, can I talk to a doctor on your staff so I can, like mano a mano, explain to the doctor why this patient needs to go into the care because they can't take care of themselves? Here's what happened. The insurance company, Medicare Advantage, physician defending the denial was an OBGYN. Can't read that. OBGYN, sure. Quote, a surgeon that delivers babies isn't used to handling sepsis cases, 𝗏𝗏𝗏 said. Well, duh. We've heard all kinds of cases like they'll have a podiatrist review a cardiac admission, foot doctor, heart condition, foot doctor denies the cardiologist putting somebody in. Only happens in the world of Medicare Advantage. We have thousands of stories with the experience of 26 years to go on, not just reading a freaking article in the last year, having gotten your license. Bless your heart. Sandra Tate, oh yeah, it gets worse. Sandra Tate of Cuero, Texas said her family's Medicare Advantage plan created problems for her family in February 2022. You see, her husband required physical and respiratory therapy after a 10-day stay in ICU. Although a previous plan from Humana had paid for this treatment 4 years earlier, this request for reimbursement was denied under her new plan from UnitedHealthcare. After arguing with the insurer for 30 minutes, Tate, a former school nurse, said she was never told why. Quote, "I pay my Medicare premiums and also my insurance premiums," Tate told NBC News. Quote, "I don't understand why Medicare Advantage is not wanting to pay for rural hospitals that are taking care of you," end quote. The UnitedHealthcare spokesperson said the company would not comment on the game. In its financial filings, UnitedHealthcare describes how rates paid by the government on Medicare Advantage plans can fall below what the insurer calls cost trends. To combat these profit pressures, the insurer said it can, quote, "seek to intensify our medical and operating cost management and, quote, adjust member benefits," end quote. For 8.5 years, the Alliance Healthcare System's inpatient geriatric psychiatry program helped older patients in Mississippi with depression and other mental health issues. The 15-bed facility offered group and family therapy as well as an inpatient program that could run from 1 to 3 weeks, said Mr. Selma Dukes, its former director. I have a picture of him too. Medicare always paid for the services, Dukes said. But a few years ago, they started to see more patients with Medicare Advantage plans denying to pay. The insurers would reject claims for patients with depression and dementia, agreeing to reimburse only for those who are suicidal, paranoid, or homicidal. Well, by then, it's maybe a little bit too late. Quote, "It had to be extreme for them to say, we will allow you to bring them in," Dukes told NBC News. On March 28th, the program closed its doors. Dukes said the result of the denials, quote, "It was heartbreaking, especially with those who had been dealing with us for a long time," they recalled. "You know you can help, but you can't bring people in for free." Meanwhile, Rose Stone is once again receiving health care at Alliance Healthcare System. She junked her Medicare Advantage plan and returned to original Medicare with a supplement. Wait, what? She's once again receiving health care at Alliance Healthcare System. She junked her Medicare Advantage plan and returned to original Medicare. Everything with a supplement. Everything is fine now, he said. That's not my opinion. That's how it works in the real world of insurance. But if the only thing that you're selling is something that you read in somebody else's article, because you're a researcher and you're a computer nerd for a living, welcome to the insurance industry, by the way. People's lives are at risk here. The recommendations that you make carry with them lifelong or short life consequences. Yes, you should be passionate about what you do. Yes, you should stay up and research so you don't screw somebody over and make a wrong recommendation to them. I spend half my time trying to solve problems initiated by other agents out there who just shove people into plans because it pays them 3 times as much. And yeah, I think more people should be talking about it. And the fact that they're not, there's something wrong with you, not me bringing the light to it. Anyway, 2 ways you can go with Medicare. It's important that you know this. Probably just talked right over the whole thing. You didn't even see me, but that's cool. Most people don't read the Medicare and You guidebook that you get every year. That book is made for you to see all of your choices. Smaller and smaller in there does it make any reference whatsoever to original Medicare, as the intentional goal of the U.S. government is to get people off of the Medicare rolls and put them into Medicare Advantage. Call it the insurance lobby on K Street, call it the Better Medicare Alliance, 𝗲𝗄, the other people that are shoving everything into Medicare Advantage and saying, it's okay, oh wait, you're denying care routinely. Why are you doing that? Why are you causing hospitals to close? No comment. We do what we do. So in original Medicare, you can go to any doctor or hospital that takes Medicare anywhere in the United States. This is from your book. This is from your Medicare and You guidebook. This is your material, not mine. I didn't make this. This is the way it works. In most cases, you don't need a referral to see a specialist. Absolutely true. And I can't think of a case where we've had to have somebody have a referral to go to a specialist. Not one ever. However, in the world of Medicare Advantage, the all-in-one complete plan where you can get free dental will what the freaking do. In many cases, you'll need to use doctors and providers who are in the plan's network and service area for the lowest cost. Higher cost means it ain't going to be covered. Some plans won't cover services from providers outside the plan service area. Those that do are called PPOs, and they'll charge you an arm and a leg if that doctor agrees to bill that insurance company specifically for you while already having decided not to join that company's network. Good luck with that out-of-network doctor. You may need a referral to go see a specialist. You can bank on it. I'm under no illusion that there are plans called PPO plans, Medicare Advantage plans, sold by those agents who are just ready to handle the objection that you may give if you know better, if you have eaten of the fruit of knowledge of good and evil, and you know, I could go to anywhere I want to on original Medicare, okay? How are you going to sell me on this Medicare Advantage plan thing? Agent says, I got the answer, ding, ding, ding. The answer is you sign up for a PPO plan. See, it says right here, in-network benefit, out-of-network benefit. And like I said, what they give in the big print, they take it away in the small print. So go look at the small print and say, where it says, as long as you're a provider that you're going to outside the network, who's already chosen not to join our network, agrees to bill us for the claim for just little old you. Now, will they do it? Likely not. You better get on the phone to that provider and say, hey, I'm signing up with this PPO plan. I know you're not in the network, but would you agree to see me as a patient and fill out all the claim forms with this one insurance company just for little old me, and see if they will? So what they're saying is, yes, you have an out-of-network benefit. Great. By the way, look at the max out-of-pocket on that out-of-network provision. It's generally 2 to 3 times the cost of the out-of-pocket maximum on the internal side. So the huge incentive is to stay in network. Now, God forbid you go to an out-of-network provider, and then you have an after-action claims review from that Medicare Advantage company who says, yeah, you went to the out-of-network provider. Yeah, he decided to accept your claim. However, in reviewing this claim, this did not meet our determination model, so we're not going to pay for it because you did not seek clarification before, you did not seek a review before you went in there, and we're not going to cover it. So that's 100% on you. We have no relationship with that doctor, so we have no way to claw back those funds from him or negotiate for you on the benefit of a discount. You can't use your original Medicare card because cut that sucker up while you're on a Medicare Advantage plan. It does not apply. When you give up your Medicare to go on a Medicare Advantage plan for that calendar year, which you can sign up for during that date right there, it takes effect in January. Starts January to December 31st. That's your contract year. So that entirety of the time, you have to play by their rules, do everything that they say. There's also another period of time just for education purposes. January 1 to March 31, you can also change plans if you don't like the Medicare Advantage plan that you signed up for. You can change that plan January to March 31st. Or you can drop original Medicare and go back to your Advantage plan and go back to original Medicare during that period of time too. Not just this period of time, October to December, but this period of time, January 1 to March 31. Important that you know all of your rights and remedies. Here's where I got my first insurance license, 1994, about when the guy was commenting about me was 6 years old. That's cool. I was already helping people with insurance then. And I think that experience matters. You be the judge. Do you want somebody who is going to be taking your enrollment, who has book knowledge? I mean, this is what the book said. I found a study that says that, only 13% of those people denied would have been approved on original Medicare. It's not really affecting people on Medicare Advantage like that showboater, that carnival barker Westfall's doing over there on the YouTube. Okay, you stick with that. And when you have enough experience to know what life actually is, when you've put enough people on Medicare Advantage plan without letting them know that all this is a possibility, see how you sleep well at night after that. After you go back and go, what did I do? What did I put all these people on? What's the outcome? I've helped all these hundreds of people and put them in a plan that I didn't tell them this is a possibility. Oh, you'll get those calls. You'll get the calls from the people who say, You signed me up for this plan saying I could go to this doctor. Well, guess what, genius? He's no longer in the network. What do I do now? I don't know. Go find another doctor. Good luck. Okay. How does that work out for you? We had a 5-star review the other day. I want to thank this person for having done that, Miss Donna Lynn. And then 𝗵𝗿𝗁 just commented this. I thought this was cool. He said, you may have just helped save my brother's life with the information on the underwriting holiday. It's a thing going on in California where there's no underwriting for Medicare supplement with one particular insurance company happening right now. It ends at the end of the year. Literally, he already signed up on your website to discuss it with your team. Yes, able to help, and very, very glad to do so. Hey, if you want to see what's going on, be one of those lurkers and just look as a keyboard warrior in the comment section of our videos. Now, I have to approve them because there's a lot of cuss words and angry insurance. This is when I was at the sheriff's office, also when he was just a child, our commenter. And this is when I was educating the public on how not to get scammed, identity theft, child predators, how to keep your children safe, how to keep your bank account safe, and that kind of stuff. That was my jam. And I guess it still is. I don't like people being screwed over, especially our most vulnerable population like seniors. I think it's wrong, and I think people should stand up for them, put the truth out there, and let the chips fall where they may. 8.5 million views on YouTube so far. We're not doing too shabby. And I'm going to continue to do this because I think this is my mission. And if you don't like it, don't watch it. If you do like it and you find some value in it, please like this video and subscribe for updates on Medicare because they're going to be more important as we go forward. I have another thing coming up on ghost networks and how they really may affect you. You don't want to miss that video. So make sure you subscribe to the channel and please share this with anybody who's considering their Medicare options, not just now, but as they're turning 65, as they're leaving their employer plan, they're making their choices, they're making their decisions on what to do for Medicare and far into the future. Because we don't just work during the annual enrollment period. Matter of fact, it has little to do with us at all. It does not affect Medicare supplements whatsoever. If you have a Medicare supplement, you don't have to do anything. It just continues to renew. And the benefits don't ever change on Medicare supplement. They change on Medicare Advantage each and every year. So if you're on a Medicare Advantage plan or considering one, make sure you've read your annual notice of change, which got delivered to you in September. Many of you, there's so much stuff to tell you, but many of you have signed up for the electronic delivery of your annual notice of change with your Medicare Advantage plan. So you didn't even get it in the mail. You better research that sucker and find out what's new for your benefits for the next year. If you don't like it, you can change. You can go to one of our websites called MedicareAdvantageNearMe.com. MedicareAdvantageNearMe.com. And if you go there, you can see the Medicare Advantage plans that we're contracted with, and you can see their benefits. You can read the small print. You can choose to get on one, change one, whatever you want to do. We're here to help you. That's our phone number. God bless you. I'm tired and I'm going home. Thanks for being here, y'all. I really appreciate you watching. Please leave a comment below. Love to read it.